stuff. I think the current crisis has acted as a bit of a catalyst for some of the enablers that have helped us to rapidly progress. So the sort of things that we've seen happening around the country including rapidly establishing those partnerships, and as ever, we'll probably come back to this, where the relationships exist and have been established, that's much more easy to progress. But partnership, data sharing, which, as you know, is a huge enabler and has been a huge obstacle and a challenge and remains a challenge for many systems. We've seen some rapid progress in areas to just make that happen because it's had to. And then, going back to the point I made before, decisions have had to be made, and it is as somebody who's worked in analysis for 20 odd years, I think we've all faced that challenge of just being asked for more and more information, paralysis by analysis, as we've called it. And actually, times have meant we've had to make decisions. You've had to rapidly pull together what you know and make a decision based on it. And I guess more broadly, and we were just reflecting on this before the interview started, is that information, data and analysis are now front and centre. And that's not just in our professional lives, it's in our conversations we're having in the virtual pub after work, or with our friends and family. Who'd have thought they'd have been discussing our values on a Zoom call with their grandparents? It's strange times, but it is, the value of it, I think, is something that's much more in the public consciousness now. So even more than when we do.
I think more than ever, it sort of highlights the need for really responsive, accurate, robust, comprehensive, insightful analysis, and which can be acted upon quickly. So the pandemic response, things are rapidly changing. There's sort of data here, there, and everywhere, and there's a real call for good, reliable, robust intelligence provided straight up to decision makers for them to act upon really, really swiftly. And I think one of the other sort of interesting sort of impacts of the pandemic is it's almost forced people within different organisations to come together and work more closely from a sort of analytical perspective. So certainly in the conversations that I've had with public health intelligence staff, they've definitely been working more closely alongside their trust informatics colleagues and their CCG BI people and CSU analysts, for instance, just to try and join up and develop that sort of holistic understanding of what's going on in a rapidly changing, very complicated situation.
And there has been a lot of sharing of code, sharing of expertise and models, but many of those networks had to be built and weren't already in place before the epidemic was hit, and that's not ideal. We should be more prepared than that. The community should be much more networked, so that when things like this happen, we don't have to step things up. We're ready for it. And we've also seen on the data front, it's often been very hard for analysts to get access to quite basic data, and as a result, it's been quite challenging to adapt some of the models that exist nationally to the local circumstance to make better decisions. So we need a much more kind of open data system, as well as better networks, and they need to be in place not just when a crisis arrives, but they need to be in place and strengthened all the time. I think that's one of the big areas of learning that we've seen, in my opinion.
I can't help myself, which is that the only thing that I've thought about when looking at the COVID response has been just that I wish that we'd done some of this hard work earlier on. So I think you can see people are trying to work in this new way now, and it's so gratifying, and I really value it, and I feel sure that it will carry on. I don't see why people would stop. But there are hard problems. I read a Health Foundation blog post about this the other day that was hit the nail on the head for me, really, is that collaborating, whether it be through source code or any other type of collaboration, is hard, particularly across organizational boundaries, particularly across data sets, particularly across patient groups, across demographics. It's difficult. It requires a lot of soft skills, a lot of technical skills. It requires a whole way of working, a whole way of even of organising teams, even some of the most basic stuff. And you can really see the kind of the gears are grinding because the NHS is trying to work in a new way, but using the old skills and the old methods and the old and all that kind of thing. And although I'm really glad to see what's going on, it does make me feel a little bit sad because I think, well, if only we'd seen this coming, if only we'd had made 2 months warning, even if, just to say, something really, really bad's going to happen, you're going to want to collaborate, then maybe we would have done some of this stuff, before all this happened. And I have to, this is probably more for the technical people of the audience, but I have to give a name check to this, which is that the other thing that this has really surfaced to almost to probably to the top of government, I would think, is just how bad data sets are. I've seen my Twitter is absolutely on fire every day with people talking about having to scrape data off a website, and they publish data and then they remove yesterday's data, and people digging around through old data sets that have got the spreadsheets are all laid out in the wrong way. And that's something that we've been talking about on and on and on for years.
It needs people who are in positions of authority to accept that the world has changed now, and Zoom is not going to kill the NHS. Open source software is not the monster that people think it is, and there needs to be a loosening of the corsets around all of that stuff, I think, as well. And obviously, I mean, there are caveats attached to that in terms of security and all the rest of it. But when I'm seeing people having to do Zoom chats, on personal mobile phones because the NHS won't allow them to put it on the machine, my heart sinks a little bit. So I think that there are some good things that have come out of this that I hope do stick.
So quite interestingly, we've been through a number of years of information governance, and everyone's quite risk averse about information governance. I think with the technologies that we've actually got an opportunity to manage the privacy concerns of individuals with actually the utility of that data. And I think we mustn't lose the utility of the data while we manage the privacy concerns. So balancing that technology is going to help us. I mean, I'm really on the charge to democratize data, to make it available to those that need it, when they need it, and how they want to use it. I think where we're really trying to charge with nationally is to make sure that we have common ways of viewing data and also creating analysis. So very much along the standards, making sure there's a common, ontology or way of looking at data, so that we're comparing apples and apples and pears. Otherwise, it just creates a very rich dialogue, but actually not a very usable decision-making dialogue.
Starting to see under COVID, really shaking out, is the open use of data and the transparent sharing of data. And I think there's a role, and it's quite a difficult tightrope to walk. So you are sort of a commissioner and I'm sort of a provider. So I can keep my cards close to my chest because I don't want you to performance manage me, and you can try and look in and see how I'm running theatres until I back you away and say, I'll deliver the RTT standard, don't worry about how I run my theatres. I think if you and I had a different relationship where we were working together in an independent way, we might still be paid by our host organisations, but we were allowed to have an independent voice, which has sometimes criticised how my trust works and sometimes criticised how you design services for the region. That I think is really important. I think if we can drive a kind of a greater independence to analysts, so they can put data up without someone saying, well, you can't show that because it hasn't been through Gold Command or it hasn't been signed off by the Chief Medical Officer. I think we need to be quite bullish and say, we're just an independent voice. We don't work for you. We're not here to give you evidence against your enemy. We're just here to provide a kind of an independence. So because data intrinsically doesn't take sides. And I think if you just put it out there much more independently through the use of open data, much more transparent data, that's a drive that I think we should take. I think your and my analysts should be thinking, This is quite sensitive data I'm putting out there now, but I'm putting it out for good reasons. I'm not putting it out to embarrass someone or to score points, but I'm putting it out there because I'm worried.
I'd like to retain the multidisciplinary approaches that have been taken to all of this. You know, I've done more work with epidemiologists and operational researchers than I can ever remember in my career. So I think the silos between professions are breaking down, and that sort of overlapping Venn diagram of there's some core analytical skills, a way of thinking through problems, and then obviously you have your specialisms around that. But that's one thing that I'd like to retain. And the other thing is just the breakdown in organizational boundaries. I mean, there's always just a slight competitive tension, which can be healthy, over what organization is going to lead on this analytical issue, who owns commentary and analysis on A&E performance. All of that has just gone, has fizzled away, where people say, I'll take that one, you take that one, we'll share staff moving across. So I'm not saying that organizations need to end, but it's back to that networking point of, I feel much more connected across different professions, across different organizations than I have before, partly through the new relationships that you've had to form, but partly because you're facing a common problem, and that's a very specific common problem at the moment with COVID, but it could as easily be how you maximize value for money for investment in health and care services, or how you reform social care financing. So this common problem that unites people, I think, is something to hold on to.